Today's date is July 31st, 2014. We're here with Shadia, who came to us from Rochester, New York. Shadia, I have your permission to video you and post you on YouTube, correct? Yep. And we'll get into other reasons why you came. I'll splice it in. But today we just want to demonstrate for a visiting physician what happens with teeth. Mm-hmm. And you had a problem the other day with tooth number 13, and then I found another tooth.
Right.
So what we want to do today is look at the range of motion of your neck.
Mm-hmm.
Turn your head to the right, please, as far as you can. And there's some limitation. Turn it to the left as far as you can. And there's some limitation. Now, I'm going to ask you to make your head straight. Mm-hmm. And bend your head backwards as far as you can. That's a significant restriction. Bend it down as far as you can. And let's move your hair back. Mm-hmm. And bend it down as far as you can, and that's a significant restriction. Okay. Some other problems too? You were having problems in your legs, right? Standing? Tell us
That's
about
mainly
it.
why I came here. For the last 3 years and 2 months, I have not been able to stand for more than 2-3 minutes because of... Sorry.
That's okay.
Because of severe pain in both my legs. Chronic debilitating pain in both knees, and it runs up and down my legs, and then eventually goes, when I try to stand up, my back and up into my neck. And it just basically happened overnight. I had a few symptoms before that of muscle weakness and severe menstrual cramps and heart palpitations for about 1.5 years before that. But then this just like happened one day. So yeah, I was walking with a cane for 1.5 years, and after trying tons of doctors and tons of different therapies, I'm at a point where I could stand for about 2-3 minutes max, and I can walk for 10 to 12 minutes if I continuously walk, but that's my limit. And my legs are constantly aching. I have to always have them elevated throughout the day. It's pretty much been hell.
Understood. You came a long way to see us. And the first time you were here, we injected number 13. It didn't do much, and then we did number 2. And that's what we're going to do today to demonstrate for the visiting doctor, okay?
Yeah.
Just did your tooth again. Please bend your neck down as far as you can. As far as you can. Touch. Now go back as far as you can. Doc, may I video you?
Sure.
Have you ever seen anything like this before?
Never.
Does this come as a shock to you?
Yes.
You want to say anything else?
I'm speechless.
All right, let's see you turn your head to the right and to the left. You see significant improvement there, don't you?
Yeah.
Look at that. Okay?
Yeah.
And the reason why is because that tooth is number 2, which is right there, which is the stomach meridian. And the stomach meridian involves certain aspects of the leg, because it goes down the leg, and it's probably infected. And we have sent her to a dentist, right?
Yes.
Who has done an x-ray, and he's found there's a cavitation there, and you're getting surgery tomorrow, correct?
Yep. I have 3 spots of infection in the bone up here, and 1 infection in my root canal over here.
Very good. I wish you luck, sweetheart.
Thank you.
Bye. Today's 127, and this is a little bit different pose. You can see a white background here. Instead of my other nicer things in the office, this is Shadia. I videoed her before. Shadia's been through the mill. She came to us from the East Coast. She's been here several months, seeing other people too. When I checked her teeth and I did her teeth and injected them, the pain in her knees and her back got all better. I sent her to dentists and they worked on her teeth. She got better, but temporarily. I found more problems in the teeth. The dentist couldn't confirm it. So it took, after a couple months, they found another problem in the teeth that I was able to pick up months before, correct?
Yeah.
But they still haven't been able to fix it, is that correct?
Right. Well, then, yeah, because then we injected up here again.
And now you're here after getting all kinds of work from a lot of different people. And your pain comes on in your back and your knees when you stand, which is why I have you standing right now.
Yeah.
And you're leaving tomorrow after being on the West Coast for months, getting a lot of work done, and you're giving me one last shot now to see if we can really firm this up.
Yeah.
I found a couple more areas that I could potentially treat with neural therapy, which I did. Your umbilicus and suprapubic pelvic, right? We just did that, no change, correct?
No change in my knee pain at all, no.
Right, so you stood up and the knee pain came on, correct? So while you're standing and your back is up against this wall right here, while you're standing, I injected tooth number 3.
Yeah.
And before I did that, you had knee pain, correct? From standing. After I injected your tooth, what happened?
It went away within like seconds.
It's all gone?
I'd say 90%.
90%. Okay. It can't, to me, it can't be placebo because I just shot your navel. I just shot around your pelvis, right?
Yeah.
And now I just did your tooth while you're standing, while you have pain. And
No, and I literally feel every time you shoot this area, it's like this, I can't explain it, but it's this feeling, I could feel it going down, like almost like heat going down the legs, and then it just like, the knees just like, the pain dissipates.
it dissipates. And the heat, that would be, from my perspective, it would mean circulation. Circulation opened up. So something going on with that tooth has choked off circulation, which is causing pain. It's like a reflex sympathetic dystrophy. Am I making sense?
Yeah, and my knees, from my knees down, it's always cold too, especially more at nighttime, but yeah.
That tooth number 3 in acupuncture, German acupuncture, is the stomach spleen meridian, which controls part of your legs in that area. So while I'm really sad right now that you don't have a total resolution, I feel fairly confident this was a controlled study here, or rather controlled, because I already gave you injections today. Nothing happened, and while you're standing and you have the pain, because that's when it comes on, and I do that tooth, pain goes away. You agree with me here?
Yeah.
So that's what's going to have to be paid attention to, and that's out of my province, but I'm satisfied that at least I nailed the diagnosis for you. Okay? Shadia, thank you so much for giving me the opportunity. And I can post this on YouTube?
Yeah.
Thank you. It's a
Thank
real
you.
blessing to have served you.
Thank you.
I wish you a safe trip back.
Thanks.
Here is Shadia's friend who came to us, and you're her dear friend.
Yes.
And you've seen some amazing things, haven't you?
Mm-hmm.
What are your thoughts on what you just saw today after all she's been through?
It's coming from her mouth.
Can you think, can it be anything but that?
I have no clue.
Because you were clocking this. Yeah. You were clocking how fast it took to get rid of that pain after I did her tooth.
Seconds.
Seconds. I'm kind of blown away myself, but I can't treat this. It's not my province to treat. It's a dentist.
Right.
All I can do is say, I believe this is where the problem is.
We'll get there
Good.
with your help.
Thanks. January, Shadi is leaving tomorrow, and she wanted to have a couple comments about what her experience was like at the office of Dr. Sue and Rowan.
Yes. First of all, I need to say that they're both amazing doctors, and Dr. Rowan has been nothing but exceptional for me. Just I've gone through a lot, and he found in the first week and a half that I was here when I first came to California that when he would numb my mouth up here, all my pain would disappear. But we thought it was infection and the pain wasn't going away. And I tried different doctors. For several months I've been out here, and he found out that I was ready to go back home and called me and begged me to come back to treat me for free, completely for free, on his own time. I know he's very busy, at his own expense, to really try to figure this out. And twice I've come back now, completely on him, and it's been amazing. I mean, he's tried many different things. We injected my knees, we injected other different areas. We found interference. The pain didn't go away, and we came back to here, and instantly the pain's going away. So this absolutely has to be the source of where everything is coming from. I'm still not healed yet, but at the same time, I feel like I'm pretty confident that we've found where it's coming from, and without his help, I wouldn't have been able to do that. So thank you so much for everything. You're a blessing to not only me and, Sarah, and you've been so kind to us, but also to thousands of other people that I know you've already helped and will continue to help. So thank you very much.
Thank you, Shadia. Sarah, do you have any comments?
Yes, I would like to say he's not going to give up on you. Dr. Rowan will find a solution, one way or the other. Thank you for everything.
Thanks. Have either of you seen or been in a physician's office that looked at patients like this before?
No. Back home in New York, the doctors are everything's segmented. And, if you have knee pain, they only look at your knees. If you have an arm pain, they only look at your arms. They don't look at the entire body. And Dr. Rowan looks at the entire body collectively together to figure it out. I have severe knee pain where I cannot stand for more than a few minutes. It's been going on for 3.5 years, and I think it's coming from my mouth. So without him, I wouldn't be able to know that. Now we just got to figure out how to fix it. So.
And I'm in a dilemma because it appears that it's your tooth. It appears that it's number 3. I'm not a dentist, so I can't be the one to do this, and that is a normal tooth, and it's not even a root canal.
Right.
And who am I to say what to do? I'm not the dentist, so this is a dilemma. I would not tell you to get the tooth taken out, but we've already seen in your case that one tooth I said is a problem, and 3 months later the tooth is dying that I picked up 3 months before.
Yeah.
So I don't know what's going on here, Shadia. All I am is a detective, and I just try to find the source. But I want to just thank you for complimenting us. It means a lot.
Yeah, you guys are amazing. And I mean, I don't know any other doctor that would call me back and basically treat me for free because you really want to find the answer and you really want to help me. So thank you.
The result is the bottom line for us. And yes, I have an ego. My ego isn't getting my patients better.
Yeah.
Thanks.
Thank you.
We're back with Shadia. Today's the 5th, August 5th, 2014. Shadia did have her dental work done on Friday. She had root canal number 13 taken out and cavitation number 12 taken out. And there was a lot of infection. There was black and green stuff, right?
Yeah.
And you actually did better that evening, but the next day things weren't so good, right? And a lot of your problems were back, correct?
Yeah.
All right, let's take a look now at your range of motion of your neck. Bend your head back, and now bend it down. Okay, and let's have you turn your head side to side, and the other side. Okay, so this is 5 days after 4 days.
Friday, Saturday, Sunday, Monday. What's today? Tuesday?
Today's Tuesday.
So 4 days after.
Yeah, 4 days after you had your dental surgery. And we're just going to inject number 2 because it still checks positive.
Yeah.
And we're going to see what happens, okay?
Mm-hmm.
So about 10 seconds ago, maybe 30 seconds ago, we injected number 2 again.
Mm-hmm.
You're checking strong. Let's see you turn your head from side to side. More. Go the other way. Good. All right. And now in that position, bend your head back as far as you can. All the way.
Still restricted.
Bend it down all the way. Can you get any further than that? Okay. Today's date's August 12th, 2014. We're back again with Shadia, who has a very interesting story. Now, we videoed her before. We showed the extreme improvement in the range of motion of her neck after we injected a tooth, particularly number 3 and upper right. And this was done in this office, and it was dramatic. She was then sent to a local dental surgeon, oral surgeon, who found horrific infection in there, right?
Mm-hmm.
Dead bone, black, green, oozing stuff that was in there, right?
Yeah, in one and two.
In 1 and 2.
Where cavitation was.
Where
yeah.
okay. However, you didn't get fully better from that. And I really did expect you to get fully better, especially because the test that we do, shooting some numbing medicine in, got you 100% better.
Yeah.
You couldn't believe it. So you came back to me last week, and I injected it, and there was a marginal response. So, and it still tested positive in my hands. I said, I think there's still an interference field, right?
Mm-hmm.
So I sent you to the dentist because he can get a numbing better than I can. I'm
Right.
not a dentist.
Right.
And he did that today.
Mm-hmm.
So tell the viewer what happened today after you had the numbing done by the dentist.
Okay. So the surgery was in 1 and 2, the cavitation was, and also a root canal here in 13. So both of those were taken care of. The root canal was completely removed out, dead bone, crazy infection. But ever since then, my bottom tooth here, where I had a wisdom tooth removed about a month before I came here, has been extremely sensitive as well. So when I went back today, he first numbed the bottom area where the wisdom tooth was removed, and my problem is I can't stand for more than a few minutes without severe pain in both my knees, and then it runs down my legs and then up into my back. And after he numbed this bottom area, I was able to stand for about 15 minutes, which was, much better. I had about anywhere from 10 to 20% pain of what I had before the injection, and I had some pressure in my lower back, but I have some lower back issues as well. Then he numbed the upper part where 1 and 2 cavitation was, but a little bit more forward, so I think more towards like area 3, and 100% of my pain went away in my legs, which was amazing, and I stood for 40 minutes with that, so we know that there's definitely still infection probably going on in my body, in my mouth.
Were you surprised that the 100% of the pain went away with that?
Yes and no.
That was
yes,
my prediction. That was my prediction that you had a problem there still.
But it's been a very emotional ride because when we first initially injected it before my surgery, the pain went away. Then I did the surgery, and my pain didn't go away, so I was kind of confused what was going on. And now we just injected it again, and the pain went away 100%. So I know there's definitely got to be
There's still
infection.
problems.
There's
there.
still problems. Yeah.
And for the viewer, I may post this on YouTube.
Mm-hmm.
Yes.
Yeah.
For the viewer, I often find that when you clear or treat one interference field, another one that you didn't pick up before shows up.
Mm.
So we went after the one up here,
Right.
treated it, and now the one down here is showing up.
Yeah.
So that needs to be treated too, and the dentist did a really good thing checking on that.
Yeah.
And I'll tell you the story of a woman that I saw in Alaska. She was sent to me because she had severe pain here
Okay.
at the lower ribs. Severe, so severe you couldn't touch her. And she couldn't play softball. She was in her late 30s, maybe early 40s. And she was miserable. The doctors had done all kinds of tests on her liver, gallbladder, and even her pancreas. She had marginally elevated liver enzymes, not too high. They did a very dangerous test called ERCP, which looks at the pancreatic duct. And that was negative. It's dangerous because it can induce a pancreas problem. And her gallbladder, they decided they want to take it out even though they couldn't find anything wrong with it. So remember, she had elevated liver enzymes, her liver was dysfunctional, and she had fatty infiltration in her liver. Her dentist sent her to me because she had 4 root canals. All were in canines, those are eye teeth. In German acupuncture, those are connected to the liver gallbladder meridian.
Wow.
Very unusual to have root canals in those teeth. They're very resistant, but all 4? In any event, they all tested positive. The dentist removed all of them. She got better on the spot. Now, he removed them after I tested them.
Yeah.
I tested them, and she got better so that I could mash her. I mean, really mash her. No pain. So he took them out. Pain went all the way. 2 weeks later, she came back in pain again. I checked all 4. One still tested positive. I numbed it. Pain went away. I sent her to the dentist. He scraped it out a second time, and she was fixed for good.
Wow.
and her liver enzymes came down to normal. So I want to give you this story because I know you're
Yeah.
you feel bad because it didn't get fixed the first time. In my experience, that can happen. I'm not the dentist, so I'm not the one to treat this. But for me, I'm honored that you came out here from the East Coast.
Yeah.
And that I think we made the right diagnosis at this point. Certainly, the dentist really helped us out today by getting a good numbing of that now, which I couldn't do. And you were pain-free. So at this point, you will be in the hands of the oral surgeon, and hopefully they can get out whatever is still left in there that's causing this apparent reflex sympathetic dystrophy.
Yeah. Thank you.
Okay, thank you very much.
Thanks.